Hello and welcome to Guru Performance ISSN Diploma Research Review. In this video I'll be providing an overview of the recent paper, Effects of High versus Low Protein Intake on Body Composition and Maximal Strength in Aspiring Female Physique Athletes Engaging in an 8-week resistance training program by Campbell et al. In 2018. If I pose the question to you now, what is the role of protein in the body? Perhaps you might describe its role in adaptation and repair of tissues from exercise. This is often the response I commonly hear from sports nutrition students. This response is undoubtedly true, however, I want to begin this presentation by outlining protein's role in a much broader sense. Proteins are the macromolecules essential for living, such as this DNA structure you see here. Now, Michael Houston, in his excellent book, Biochemistry Primer for Exercise Science, underscores this wonderfully when he wrote, "Everything we do, everything we are, and everything we become depend on the actions of thousands of different proteins." You see, proteins perform a host of cellular functions, such as accelerating biochemical reactions, transporting substances into and out of cells, hormone functioning, maintaining cell structure, immune support, the transmitting of vital information, producing movement, and the regulation of new proteins. Now, as you sit watching this video, rest assured that you do so comfortably due in part to your body assigning 40 to 50% of its structure to skeletal muscle. This orchestrates key roles in carbohydrate and lipid metabolism, nutrient disposal, and the exchange of chemical energy to muscular contraction. Now, the latter is governed by the proteins actin and myosin, known as myofibrillar proteins, as these are located in the myofibrils of muscle cells and are responsible for the use of chemical energy stored within the bonds of adenosine triphosphate, ATP. It is these proteins that accumulate over time through the combination of protein intake and resistance training, and over time result in muscle growth. However, the extent of increased muscle growth is dependent on a range of variables. Now, these include the quality of resistance training programming, training status, age, baseline body fat, energy intake of the diet, the quality and quantity of protein consumed. Today, I want to put protein intake and the effects on body composition under the microscope. This research group assessed bikini and figure competitors consuming high or low daily protein intake in conjunction with an 8-week resistance training program. Currently, there's limited research on protein intake requirements for resistance trained female athletes, specifically in athletes where a reduction in weight exclusively from fat mass with a high retention of lean mass is pursued in order to gain a competitive advantage. In these respective female physique categories, muscle symmetry, shape, and definition are key marking criteria prioritized by the judging panel. Thus, lower body fat levels and ample muscle mass are key requisites for success. This is attained through calorie restriction, resistance training, and often cardiovascular exercise in a bid to attain the appropriate conditioning. Now, the purpose of this study was to see whether high versus low daily protein intake would result in a difference in body composition in conjunction with 8 weeks of supervised, undulating, periodized resistance training. Let's take a look at the study. Now, 17 aspiring female physique athletes with at least 3 months of previous weight training experience were matched for baseline fat mass and randomized into either a high protein consisting of 2.4 grams per kilogram per day of protein or a low protein diet consisting of less than 1.2 grams per kilogram per day of protein. The intervention was undertaken throughout the participants' off-season. They were all counselled on how to track their dietary intake using the MyFitnessPal app and were on strict instructions to stay close to their high and low protein recommendations. No guidance was provided on how many calories, dietary fat, or carbohydrates to consume, but support from a nutritional coach was available throughout the duration of the study in a bid to answer any of the subjects' questions. Participants were scheduled 28 workouts throughout the duration of the 8-week training block, with pre- and post-training nutrition provided to the participants in the form of whey protein. In the low protein group, this consisted of 5 grams of whey isolate consumed pre and post workout, and 25 grams of whey isolate pre and post in the high protein condition. Now, the primary dependent variables were body composition, fat-free mass, and body fat percentage, and secondary dependent variables were 1 repetition max testing, assessing the maximal strength of back squat and deadlift and resting metabolic rate. Now, so what were the results? Now, at the end of the 8-week intervention, the high protein group reported consuming 2.5 grams per kilogram per day of protein and a total of 1,839 calories per day. The low protein group reported consuming 0.9 grams per kilogram per day of protein and a total of 1,416 calories per day. After 8 weeks, the high protein group increased fat-free mass by 2.1 kilograms with a reduction of fat mass by 1.1 kilograms. The low protein group also demonstrated recomposition, which is the scenario of gaining muscle whilst losing fat mass, with a 0.6 kilogram increase in fat-free mass and a 0.8 kilogram reduction in body fat. The results of the secondary dependent variables revealed a significant increase in maximal strength, but there was no difference between the protein groups. There was also no significant difference to changes in resting metabolic rate between the two groups from the beginning to the end of the 8-week intervention. Now, before delving into what we can take from the results of this study, firstly, let's draw on a few limitations. Now, a few common limitations that loom over a lot of the research in nutrition is controlling for energy intake and the quality of the body composition model used. In this study, both offer limitations, which should have the reader consider the results tentatively. The method used to gauge energy intake was through participants self-reporting their food intake. In research, this has consistently been demonstrated as a glaring handicap due to the known inaccuracies of participants self-reporting. Just one example of this is a study in 2002 whereby dietitians and non-dietitians were asked to record their food intake as accurately as possible. Now, despite their experience with recording dietary information, dietitians on average managed to misreport their intake by 223 calories per day, whereas non-dietitians misreported their intake on average by 429 calories per day. However, as you can see, there's a large degree of variability in misreporting. One dietitian misreported their intake by 800 calories, whereas 2 subjects in the non-dietitian group misreported by over 1,000 calories. However, the researchers were clearly mindful of this limitation and tried to install measures to remedy this issue. For instance, all the subjects kept a daily diary of their food intake via MyFitnessPal, with tutelage given to all participants before the start of the study. Now, all subjects had access to their individual nutrition coach throughout the duration of the study in a bid to answer any questions related to what foods to consume and for kind of general accountability. Also, for a personal anecdote with experience coaching and conducting research on physique competitors myself, I've rarely come across a competitor in this domain who hasn't got an eye for detail when it comes to reporting their training and nutrition. The second limitation is the researchers' use of body composition measurement. The study used an A-mode ultrasound model which assesses body composition using a single beam sound wave to estimate body fat percent based on the acoustic reflection and impedance of different tissue borders. It quantifies subcutaneous adipose tissue and uses the Jackson and Pollock equation gauged from hydrodensiometry to quantify body composition. Now, it's not the case that this model is bad. However, at the moment, we need more research assessing its accuracy compared to other multi-compartment models for gauging body composition before we can really gauge the validity of its prediction. Currently, there are only a few published validity studies to its name. What the research does highlight is that its ability to gauge subcutaneous fat measurements appears to be very good. It also has an excellent test-retest reliability and inter-rate reliability, meaning measurements between skilled practitioners isn't too different. So in terms of practical application, its potential inaccuracy will at least be accurate over time, and you may get away with interpreting results from different papers and be in the same ballpark for body composition estimates. As a practitioner, accurate assessment of retesting changes in body composition is often more important than obtaining precise measures of actual percentages in these compartments. So using such a model in a personal practice would be a great tool to have. Now, it's also important to put body composition measurement into context. You should realize that there is no true gold standard measurement of body composition, as all measurements are merely predictions, some worse than others, unless of course you underwent a post-mortem cadaver assessment, which is the process of assessing all your bodily compartments when you're dead, and that's obviously just not going to happen. So, right, let's put this prediction model into context for this study. So regardless of the body fat markers highlighted, with the same kind of skilled practitioner making the before and after assessment, and with retest reliability being very accurate, we can be fairly confident that the changes that did occur over the 8 weeks were correct. In a recent study by Schoenfeld et al. In 2017 comparing the validity of the A model in 20 healthy young females compared to a bod pod, at the group level, mean body composition differences were not different, and both methods detected significant reductions in body fat. However, the study did note that the estimations predicted by the ultrasound may need to exceed 3.5% before the changes are close to estimations gauged from other high standard two-compartment models such as the bod pod. Now, to put this into context, a change in the ultrasound at the individual level of maybe 3% fat may only result in a change in the bod pod of 0.5%. Now, these results are important to consider, especially as the extent of body fat percentage lost between the pre and post intervention in this study didn't surpass 2%. Now, the third limitation is the fact that the female competitors didn't have their menstrual cycles tracked throughout the 8-week intervention. This is important to consider as the varied changes in hormones throughout a cycle induce changes in many areas of a female's physiology. For instance, in this study assessing 40 young, naturally menstruating women, weight change throughout the entire cycle varied from 0.25 kilograms to 2 kilograms. The greatest change in body mass occurred from the follicular to the luteal phase of the cycle, with individual shifts in extracellular water from the follicular to the luteal phase being as high as 1.5 kilograms. As a result, this may have influenced the assessment of fat-free mass using the ultrasound at baseline and at the end of the study. Okay, let's get back to the results. The most interesting finding from the study is the fact that the female physique competitors in the high protein group were able to consume almost 300 calories more from their baseline reported intake, coming exclusively from protein, and this demonstrated a further decrease in body fat and an increase in fat-free mass. Now, these findings are in part echoed by a series of studies led by the researcher Jose Antonio. In the first of these studies, resistance-trained men and women with an average lifting age of 9 years were split into either a control group who were at calorie maintenance and an experimental group who consumed 800 calories additionally above maintenance, almost exclusively from whey or casein protein powder. The groups demonstrated no significant differences between the groups after 8 weeks. However, the high protein group did see an increase of 1.9 kilograms of fat-free mass and no change in fat mass despite the 800 calorie surplus. The second of these studies investigated the impact of a high protein diet of 3.4 grams per kilogram of body weight of protein compared to a normal protein intake of 2.3 grams per kilogram of body weight daily in experienced resistance trained men and women on a periodized 5-day per week resistance training protocol over the span of 8 weeks. Now, the subjects in the high protein group demonstrated a 1.6 kilogram reduction in body fat, whereas the normal protein group showed minimal change. However, both groups increased their lean body mass by 1.5 kilograms. At the end of the study, the authors noted that both normal and high protein groups had subjects who gained to the extent of 7 kilograms of lean body mass and lost up to 7 kilograms of fat mass, along with other subjects who lost fat-free mass and gained fat mass throughout the intervention, as you can see in this schematic, highlighting individual variability and other independent factors that were causing the changes in body composition. However, recently we had Jose Antonio present to our students at the ISSN diploma, and he did highlight that one of the reasons for the variability in some of the subjects who did indeed see increases in fat mass may have been due to these participants not just eating more protein, but also increasing their total fat and carbohydrate intakes too. The authors of this study concluded that protein intakes above 2 grams per kilogram per day didn't appear to offer any advantage for further fat-free mass gain, but did seem to offer an improvement in body composition with further reductions in fat mass. Now remember, this was despite the 3.4 kilograms per day group consuming 400 calories more on average per day too. Again, it's important to mention that these series of studies from Antonio's lab do come with limitations too. For instance, the participants self-reported their food intake, and body composition was measured via the 2-compartment model BOD-POD, which in previous research tends to overestimate fat mass compared to DEXA and other 4-compartment models. This model and other 2-compartment models can also be confounded by things like total body water, which wasn't controlled for and can cause misreporting in fat-free mass. However, as it stands, this series of results seem to indicate a metabolic advantage with eating very high protein diets, although the models of body composition assessed, along with loose controls on reporting dietary intake, are important limitations to bear in mind. Now, at face value, some have argued that these results violate the first laws of thermodynamics, which in the context of nutrition is the difference between calories ingested versus calories expended, and the difference dictating either body tissue gain or body tissue loss. However, multiple hypotheses have been considered that keep the premise of physics in check and outline what may be going on to yield the body composition advantage. These include an increase in the thermic effect of feeding, an increase in subconscious movement, an increase in the ATP production in skeletal muscle, increases in energy expenditure in high metabolic rate organs, increased satiation, and subconscious reductions in food intake, and a suppression in liver fat production. Okay, so let's look at the second dependent variable of the study. Now, as highlighted, both groups experienced a significant increase in maximal strength with no difference between groups. Now, these findings are supported by previous research in a meta-analysis looking at 20 studies on the effects of protein timing on muscle strength and hypertrophy. The results demonstrated no impact on total protein intake on strength outcomes. Also, there was no difference in the metabolic rate between groups. Now, this is interesting as previous studies assessing high protein diets have demonstrated an increase in sleeping energy expenditure, with the increase being mainly attributable to increases in energy expenditure from high energy metabolic organs and skeletal muscle. Now, another aspect of the study that's important to consider is nutrient timing. The high protein group consumed 25 grams of whey protein immediately before and after the training bout, compared to 5 grams pre and post in the low protein group. Now, research has demonstrated that the consumption of anything from 20 to 40 grams of high quality protein, depending on the total amount of muscles recruited for a training bout, will maximize muscle protein synthesis independent of weight or gender, which may have played a role in the superior increase in fat-free mass in the high protein group. However, it's important to note that the meta-regression analyses conducted by Schoenfeld, Aragon and Krieger permitting total recommended intakes of protein are consumed, which currently stand at 1.6 grams per kilogram with a 95% confidence interval going up to 2.2 grams per kilogram per day of protein and slightly more in a calorie deficit, then the effect of imminent protein nutrition post-exercise may be minimal. So I guess from this study, a question that lingers is, would there be a difference in body composition changes between current recommended intakes of roughly 1.6 grams per kilogram per day compared to a higher protein intake of 2.5 grams per kilogram per day in female resistance trained subjects? Now, this needs further investigation. So what should you take from this study? Well, the results of this paper add further fuel to the metabolic fire of increased protein diets, offering a favourable change in body composition in resistance trained subjects, whereby in the presence of more protein, independent of the increased calories, permitting the calories are coming exclusively from protein, no further fat mass is increased and can in fact reduce fat mass further and may increase fat-free mass, but the upper limit from previous research could be about 2 grams per kilogram per day for increases in the latter. However, with limitations in the assessments of food intake and the predictions of body composition, it's really important to remain skeptical with these findings. So from this research, I guess the question is, should you advocate more protein to your athletes and clients? Well, if they're currently consuming within the range of 1.6 to 2.2 grams per kilogram per day, this may not yield any further benefit for adaptations from resistance training. However, let's say your client struggles with appetite control. Then increasing total calories exclusively from protein due to its high satiety factor and the metabolic effects of potentially not impinging on further fat gain could be a strategy to use with clients for better body weight regulation. However, increasing calories exclusively from protein can be difficult if one isn't accustomed to incorporating high protein foods into their diet. This is where, as a sports nutritionist, it's really important to apply these recommendations yourself and other advice you give your athletes and clients by trialing out recipes and to ensure the recommendations are practical and the recipes actually taste good. Otherwise, compliance will be short-lived with your recommendations. So here are some high protein recipes I make for my clients and athletes to get you thinking how you could best incorporate such strategies into your own practice. Okay, so here is a list of key papers addressing the mechanisms behind the role of protein and its effects on weight management, a few of the key protein overfeeding studies mentioned today, and other important papers related to the topic. You can find all the full text to these papers in the Dropbox link in the description. And finally, a special thanks to Dr. Jose Antonio, who's leading the way in this fascinating area of research, and thanks to the lead author on this paper, Dr. Bill Campbell. Thanks so much for watching. Please like and subscribe if you found it useful, and we look forward to seeing you again soon. And also, just one more thing, stay tuned for next week where I'll be answering your questions from this paper, so just please email me at alex@guruperformance.co.uk and your question may get answered. Thank you.